Good morning, everybody. Dr. Karen here. So after our Facebook Live that I did on Tuesday morning, there were a couple questions that came in right at the last minute, and I did not see them in time to address them on the live. And they were really good questions. I think that they would help a lot of the members in the group. So I'm going to go ahead and answer them really quickly as a follow-up to Tuesday's session. So all right, let me get started here with the first question. There are a lot of questions about putting the system all together when you are utilizing all of the different resources from all of my different programs, depending on which one you're in. Again, most people are in Language Therapy Advanced, but then we've also got people who are in Vocabulary Foundation and the Art and Science of Narrative Language or Social Language Roadmap, which really all of those together give you your complete system for addressing all of the different language components in the school age populations with kids who are, I guess the word is higher functioning. So kids who are able to communicate verbally, who are in that mild to moderate range, who are able to be in the classroom some of the time with special ed support, and even those kids who might have a chance of getting out of special education completely. So with all of that being said, let me get to the first question. So let me get this email up here. Okay, so really the question is about just putting this all together. So the first question was, I feel a little scattered with planning in terms of what to approach with students and when, mostly because I see so much of what they need to work on, and then I feel like I'm jumping around again and not being directed in my choices to sequence what I'm planning. So this makes me wonder if I should be getting the Vocabulary Foundations Narratives course or Word Study Toolkit so that I can integrate all of the programs together. So let me start by explaining a little bit about how the programs work together if you're in one of the programs, if you're in all of the programs, and explain why I've laid them out the way that they are. Now, you could be in just one of my programs and still get a lot of benefit to your therapy. I've designed it that way because everybody might not need all of the programs. I want it to design it so that you can invest in the one that is right for you based on where you might want to develop your knowledge more completely. And you have the option of adding the other programs because sometimes people might sign up for one and realize, you know what, I want to back up and do this other one, or I want to move on to the next steps. So how all of my programs work together is that Vocabulary Foundations is kind of the, if you wanted to go through all of my programs in sequence, is the one that you could start with. It's not required that you start with it because a lot of people jump right into Language Therapy Advanced, and that's fine. But what I address in Vocabulary Foundation is the overall theory behind vocabulary learning and why it's different for kids with language disorders versus why it is versus kids who are in the general education setting and who are just benefiting from the implicit instruction. So we've got to understand that first. That gives you a high level view and the big picture of what you want to be doing with vocabulary. Now, a lot of people want to start jumping right to the tactics and strategies and materials, but if you don't understand that big picture, none of the other things are going to make sense. So in the Vocabulary Foundation, I don't dive into actual therapy techniques, which is where everyone wants me to start. But I know that that's not what you need. I know that you need that theory first, because the reason why it's hard to mesh all those tactics together is because we don't have that big picture. So I start with that, and that's going to help you clarify your role when you compare yourself to a special ed teacher, a general education teacher, and other professionals you might work with, and really find your role when it comes to vocabulary, because all of us are working on vocabulary. So we want to make sure that we're doing it in a way that is aligned with what our students need and aligned with our strengths. And then I also cover in the Vocabulary Foundation how to approach word selection. And then I give you lots of examples, lots of word lists that will help you to select the right words for therapy. Now, again, this isn't a rigid guideline, like you can only use these words for therapy and you have to do, like you have to have them memorize these lists of words. It's not like you don't have to give them a list of words and say they've only made progress if they know these words by the end of the year. Language doesn't work that way. I know that some of your administrators might be pushing you to do things like that, but that's just totally counterproductive to try to get kids to know a certain number of words by the end of the year, because what you're doing is you're essentially teaching them or giving them a fish instead of teaching them to fish. You want your therapy to be about becoming more aware. And yes, that involves teaching specific words and giving them knowledge of specific words so that those words you're addressing are going to help facilitate knowledge of later or other more difficult words. So obviously the first thing that you want to think about is, what words am I even using when I'm studying vocabulary in therapy? What we don't want to do is get too obsessed with word selection, like, is this a tier 2 word? Is this not a tier 2 word, etc. So if you are in language therapy advanced and you're feeling like you want some more clarity on that, about how to select words and how to have that overall distinction of how you're different from the teacher. And if you want to get lots of examples of words that are tier 2 words, so that when you go and invest in a Teachers Pay Teachers product, or when you're looking through standard curriculums, you want to know which words are tier 2 and which ones aren't, then yes, I would recommend taking the vocabulary foundation. This particular language therapy advanced student who who asked this question said that she was looking through specific vocabulary worksheets by a Teachers Pay Teachers vendor and is wanting to know, are those worksheets appropriate? Are they tier 2 words? Well, I would say that you want to be able to evaluate that on your own. So really the way to do that is to see lots of examples of tier 2 vocabulary and understand why words are tier 2 in the first place. The other thing is that sometimes it might not matter if they're tier 2. What you really want to figure out is why they're tier 2 in the first place, and why did Beck et al. It was Isabel Beck, Margaret McEwen, and Linda Kukin who came up with that framework of the tiers of vocabulary. You want to focus less on them being tier 2 and more on the idea of why they're tier 2. They're tier 2 because they are difficult for kids and they are required for kids to understand academic context. So they're frequently occurring and they're difficult. Those are the two things that you want. And because those are going to be, you want to make sure that the vocabulary you're working on is going to help your students to learn more difficult vocabulary. So if you can say yes to both of those things, does it happen frequently? And is it difficult, meaning that it will help students understand more difficult concepts? Then I'd say yes, it's appropriate to go ahead and work on those words, regardless of whether they make the cut for being a tier 2 word or not. So that means sometimes you might be doing words that could be on a tier 3 list or a tier 1 list. Yes, technically speaking, you're probably going to be spending most of your time on tier 2 words anyways. So that's a good place to start. And that's why I include tier 2 words in the vocabulary foundation. However, it's not necessarily, you don't have to follow it rigidly, because remember, what we do is a little bit different from the teachers. We might have kids who need some work on those easier words. So if you're looking through any of those Teachers Pay Teachers resources that have vocabulary, you just want to have an idea of, is this a word that you think would frequently happen when you look at the curricular materials that your students have? Is this something that is going to happen often in that curriculum? If so, then I would say go ahead and work on it. That you could probably utilize those resources and they would be fine. Okay, let me make sure I fully addressed this question. Okay, yeah, so she's saying choosing words is still difficult for me. So I think I've addressed that. And again, this was Lori's question. So Lori, if that doesn't make sense, let me know. The other question that she had was, when should I know if I'm ready for programs like the Art and Science of Narrative Language, which is another course that I have in the Word Study Toolkit? If you have Language Therapy Advanced, that is in Module 5 under the Morphology the morphology module, and that's also in your materials library. So it comes with your course. So you already have the word study toolkit. So you're good there, Lori. But with narratives, so how it works is we've got vocabulary foundations, which is that setup of choosing words, different ways to evaluate vocabulary, owning your role. And then language therapy advanced is diving into those word study techniques that really gives you that complete system, the most comprehensive of all of my programs. But then, so I always talk about how, and I talked about this in the live session on Tuesday, how where we will end up spending most of our time is on those foundational skills, because that's like a puzzle piece. So again, and if this doesn't make sense, watch the live session that I did Tuesday, November 5th, where I talk about the Venn diagram, where we're spending time on foundational skills and we're working in those high-level cohesion skills like narratives, reading comprehension, writing. And then the teachers might be doing the other thing where they're spending most of the time on those cohesion skills and they're working in those foundational skills. And then there's this overlap here. So we're both working on both, but one person is emphasizing one more than the other. And that way, the student is getting all of what they need so that we're getting carryover, because you can't just work on one, just work on cohesion and then expect them to get these foundational skills and vice versa. It's like a puzzle piece. So the reason that I focus so much on these things in Language Therapy Advanced is because this is what you will most likely end up doing based on what your kids need if they have language processing issues, and based on your role, and then based on what other people in the school systems are typically doing. Because they're spending a lot of time on those high-level cohesion things, which is working for a lot of kids because they're learning those language skills implicitly, but not working for your kids with language disorders. We don't want to just do more of that with your kids with language disorders, because they're missing these pieces over here, which is those foundational things that I address in Language Therapy Advanced. That being said, so that's why Language Therapy Advanced is all about those foundational skills, and I teach you to do it in a way that is contextualized so that there is carryover. However, that being said, there's going to be certain times when you're going to want to start to, again, a lot of your therapy is going to be those structured things, but then you do want to make that transition. And for certain students who maybe you've been working on some of those foundational skills and you want to have a framework for tying it all together, and you want a process for working on those high-level cohesion skills, then that's when it could be appropriate for certain cases, if you're spending a lot of time on those foundational skills, to start to work in some of those cohesion skills. Again, remember, you are going to be doing it some of the time, even though it might not be your primary focus. So for certain kids who you think, you know what, they're doing pretty well with this, I want to see if I can challenge them and to apply some of these skills in using these language skills in narratives, but I'm not quite sure how to do that in a way that's structured. I teach you a framework for doing that in the Art and Science of Narrative Language. The reason that I do this separately is because a lot of people, when they come into Language Therapy Advanced, they're already doing this work on narratives and they're missing this big piece over here. So they might not need the narratives course, but if you are in Language Therapy Advanced and you're feeling like you want to pull it together, then it would be a good investment to do the Art and Science of Narrative Language, because in that program, what I also teach you how to do is use a protocol that you can do that will work whether you're doing pull out or whether you are pushing into a classroom. So that is kind of a big struggle for a lot of us, because we might have those certain students where we've been working with them in language therapy for a while, and we want to say, you know what, every once in a while I want to go into the classroom and do a lesson and do some kind of a whole group lesson to see how my students do, but I don't know how to do it in a way that's actually therapeutic for them. That's not just me floating around like a teaching assistant, and I don't know how to do it in a way that works seamlessly with what the teachers are already doing. So that's why the course focuses on narratives, because it's something that will work into what's already going on in the classroom. So if you're going to do these in sequence, it's going to be Vocabulary Foundation, Language Therapy Advanced, then the Art and Science of Narratives. So Lori, on whether you want to talk or go it through and think about the narratives course is up to you. I'd say if you're struggling with word selection and fine-tuning what you're doing in therapy, the vocabulary foundations would probably be the most logical thing if you wanted to add to the programs that you have right now. And then once you get a handle on that and you're wanting to do some push-in and do some carryover activities, then I'd say the narratives would be the way to go. All right, a couple other questions. Let me go to this other email here. Okay, so I answered the question about the Teachers Pay Teachers resources. If they're tier 2 wards or not, is there a way to decipher? Yes, you want to answer those questions of, is it difficult and will it occur frequently? And you know that if it occurs frequently and it's difficult, then it's likely to advance your understanding of other words. Okay. Next question. There's a question about a student with autism and then a question about some additional literacy certification programs and leveraging those to enhance your knowledge with what you do in the school systems and also to make yourself more marketable, possibly as a private practitioner. So she says, just had an assembly. They're looking to give the SLPs an overview of Lindamood Bell. Would it be good for us to be well-versed in the reading program that the school uses? We use Foundations and Wilson, and how would Lindamood Bell fit in there? So I will tell you that I know what these programs work on. I am not certified in any of them. But again, I have had some experience, a little bit of experience with all of them. They're all, a lot of them are focused on phonics, phonemic awareness. So absolutely, it's absolutely beneficial to you to become well-versed in what's going on in the curriculum in the school. The more you know about the curriculum, the more that you are going to be able to streamline what you do in your therapy to work on that curriculum. It doesn't mean that you need to be delivering that curriculum 100% of the time. The reason that I've created Language Therapy Advanced and my other programs is because those programs are designed for teachers who have, you know, a 30 to 40 minute language arts period every day to work with their students. We don't have that. So it's really hard for us to implement that program completely. So that's why I've designed Language Therapy Advanced to take pieces that are working from that program and then the pieces that are missing from those programs and integrate them into therapy. So I would say that as far as any of those programs that, yeah, I mean, take what you know from Language Therapy Advanced about what kids need. So again, work on semantics, work on working in orthography and phonology, and then also emphasis on morphology. I will say that where a lot of programs tend to fall short is integrating the meaning and so integrating semantics and morphology simultaneously. And when you're doing that, you're also working on orthography and phonology as well, but we're doing it within the context of morphemes, not just, you know, at. We're looking at how an entire morpheme is pronounced and what it means. So I will say where a lot of those programs sometimes tend to fall short is with morphology, and so that's why you want to make sure that you're working on it. But where a lot of them are doing well is that they are addressing phonics and phonology. But if you've got teachers who are really working on those programs, it's good for you to know what's going on. But if you know that they're not really addressing morphology, then that's where you can fill in that missing piece. But yeah, I mean, it's absolutely important for you to know what's going on in the classroom. I will say that when it comes to knowing the curriculum as an SLP, if you are not the one delivering the curriculum, you want to know as much as you possibly can. But what's going to happen is, again, think Venn diagram over here, where you're going to know a lot about language therapy facilitation techniques. You have to know a lot about other things besides the reading curriculum, even though if you are a language, it's addressing language skills and vocabulary, you do want to know a lot about the type of strategies that your students need in order to get better. But you don't necessarily need to have a 100% in-depth knowledge of every single scripted lesson that's in that curriculum, because you might not be the one delivering it. The teacher over here might know that, and then they might know a little bit about what you're pulling in, but you don't necessarily have to know everything about every component of the curriculum at every grade level if you're not the one delivering it. You want to know enough that you can think about your therapy and figure out, where am I this missing piece? It's kind of like how, let me think here. Okay, so like how SLPs and OTs might collaborate on feeding therapy. There are a lot of things as far as the oral musculature that SLPs might need to be doing that OTs are not doing, but they might be both working on feeding. The OT might be working on the fine motor control and all of the other things. They might be working on other functional things. And so they might need to know a little bit about what the SLP is doing, because they're also addressing sensory. But as far as the motor and all of these things up here, they won't be addressing it as much as the SLP, because they're working on other things like body positioning and things like that. With the SLP, they might be working on they're going to be working on positioning as well for feeding. And they might be talking a little bit about some of the fine motor things that the students are doing. They're also working on sensory. So there's an overlap there, but they're not going to be going in depth into all of the things that an OT is doing. They just need to know enough to pull it in and co-implement together. And so it's the same for literacy. It's the same for any type of multidisciplinary team. I even think about the psychologists. So the psychologists that I worked with, they did some assessments that tapped into language, but what they needed to know was, okay, is language a relative weakness relative to these other things that I'm assessing? And they would get a piece of it, but they wouldn't be able to diagnose a language disorder. I know some psychologists do that, and that's a little questionable. And I know, depending on the guidelines in your state, they may or may not be able to do that. But my psychologists that I worked with would be like, hey, they were low on this vocabulary section. And I think, I'm curious if this is something that you want to look into. So they would know enough to make a referral to me. But they wouldn't know everything about it. They would know a lot, but not as much as I did. So you want to think of it that way when you're working with teachers, that you don't need to know everything about every grade level, but you just want to have an idea of it so that you know, okay, this is what I need to be doing to help my student access that curriculum. The more you know, the better, but there might be times when you might be a little fuzzy on things. So let's say, one year, maybe you've got a lot of fifth graders on your caseload. You're going to know a lot about the fifth grade curriculum that year. And then the next year, maybe you have a lot of second graders on your caseload. So you're really diving into the second grade curriculum, and maybe you kind of forget some of those fifth grade guidelines, but maybe you've got notes and things like that you can go and reference when you need that information. We want to be as efficient as possible and figure out what we really need to know, because we only have so many cognitive resources, and sometimes it's just not useful for us to know everything. So keep that in mind. Again, you don't need to know everything. You just need to know enough to be able to pull in the amount that you need, and you also need to know enough to help the student access that curriculum and address those grade levels. Okay. Last question about the certification. Could becoming certified in one of those well-known reading instructions programs such as Wilson, Orton-Gillingham, etc., lead to any side business by chance? Okay, so this is a great question. So will it lead to any side business? I would say that the most important thing, if you don't know how to market yourself and get yourself in front of people who need your services, it doesn't matter what certifications you have. Do you need any of those certifications? No, I don't have any of those certifications. I do have other credentials, like I've got my doctorate. But does that alone help me run my business? It helps. But if I didn't know how to market and get in front of people and get people to say yes to investing with me, none of those certifications matter. People don't invest in working with me because I have my doctorate. Lots of people have their doctorate. Lots of people offer continuing education programs. Lots of people offer private practice services. People invest in programs when they have a problem and they believe that that person will be able to solve that problem. So if you can communicate and you can get to the root of their pain that they're going through and build enough trust that they see that you are willing and able to solve that problem for them, it doesn't really matter. I mean, it does. I don't want to say it doesn't matter, but you having that certification is not going to automatically win them over if you don't have those things. So you need to be able to, number one, communicate the pain that that person is having, because then that shows them that you get the problem. And then you need to be able to sell them on the solution that you are using. So if you are using one of those programs, you have to explain to them why this is the vehicle that's going to get them to succeed. And then also, again, you need to be able to get their attention. You need to be able to have a resource to get those clients to you. Those are the most important things. And if you can do those things, none of those other things are going to matter. Like having the perfect accountant, having the perfect certification, having the perfect website. Do all those things help? Yeah, but if you just have those things and you don't know how to, don't have the right marketing message, it's not going to matter what you have. With that being said, obviously those certification programs can help build your skills that are going to serve your clients. But if you don't know, but again, you want to make sure that you are good at what you do. You don't want to bring somebody in and then not know what you're doing. Chances are, if you are a certified SLP and you've been treating language, you probably are way more effective than you think you are. So you don't need to get certified before you can start seeing clients. In fact, I would recommend just doing it right now, because what's going to make you feel more successful as a private practitioner or whatever services that you're providing independently is just doing it. You don't need any certification. And the thing is that when you get that certification, a lot of people want to get those because they're kind of doing it out of certainty, thinking like, when I get this certification, then I'm going to feel like I know what I'm doing. The thing is that when I got my doctorate, I felt there were certain things that I still felt nervous about. I still had times where I'd have that voice of doubt in my head. I still get it now. And I just know that that's all that it is. It's just that fear. And it doesn't mean that I need to listen to it. So the good news is that you're probably already qualified now to provide those services. Will an additional credential help build your skills? Of course it will. And should you continue to develop your professional skills and your clinical skills? Absolutely. That's the best clinicians do that. But the best clinicians that are successful in business are the ones that know how to market. And there are people who maybe don't have those credentials. And then people who do have those credentials, the one who's going to be better at marketing is going to be more successful. And people don't like to admit that, but it's true. So that means that there could be somebody who's a mediocre therapist, but really good at communicating and marketing that could be more successful than somebody who is an amazing therapist, but it doesn't know how to market. Now, so going back to what I said, getting an additional certification, if you're feeling fearful now, that feeling's not going to go away even if you get another certification. So that's the bad news. The good news is that it's just a fear. It's normal to feel nervous about those things. It doesn't mean that just because you feel the fear, it doesn't mean that you need to not do it. All of those programs, again, they all work on those things that we know kids need. It is going to develop your skills better. If you are providing therapy privately, you are going to be able to implement more of the program that you would be able to in a school, because you're going to have more freedom as far as what you're able to do in the session. You're going to be able to work on skills that maybe wouldn't be approved in the schools because the student didn't qualify and maybe they weren't low enough. You're going to have a little bit more flexibility on, again, you can see students one-on-one. So yeah, you can implement those programs with more fidelity in a private practice. but they're not magic bullets. They're just additional things. Now, I will say from a marketing standpoint, sometimes with those certification programs, there's a directory where people can go and they can find you that way. So they can Google like Orton-Gillingham providers or whatever in their area. ASHA has one actually eventually. ASHA has one as well for private practice people. So people can go to the website, like a parent who's looking for kids or an ASHA certified speech pathologist in their area, they can go on ASHA and find that provider directory. You want to make sure that you're listed in those directories because that's one way people can find you. But I will tell you that those are not, I wouldn't just get certified and expect people to come to you. Don't have the if you build it, they will come mentality, because there are other ways that you can get people's attention more effectively than just those things alone. Do them, yes, but don't use it as a magic bullet. You want to learn how to market yourself, and you can be successful without those things. So I want you to know that you don't need any additional credential aside from your SLP credentials to start and be successful if you are really good at the business side of things. Okay. Oh, one other thing I wanted to mention about Wilson, Orton-Gillingham. Oh yeah, one more thing is that when you have those directories, yes, a lot of parents, because those companies advertise, parents are aware of them and they can go and search, but there might not be a guarantee that parents know what Wilson or Orton-Gillingham or ASHA, they might not know what those things are. Some people might, so that's going to help people find you. But all they know is my kid can't read and I don't know what to do about this. So you want to figure out other ways to get in front of them besides relying on those specific programs. Nobody cares about the vehicle. I mean, they do to some extent if they believe that vehicle, meaning like the program that you're using, they just want their kid to be able to read. They want their kid to be successful. If that's Orton-Gillingham, that's great. But if you can sell them on another approach, then they're going to be okay with that too. People don't want a certification, they want a result. So you've just got to show them that you have the vehicle that can get them the result. Maybe you have Wilson and the parent's like, well, I want Orton-Gillingham. Well, you know what? If you can show them and if you can sell them on the idea of what I'm doing, this vehicle over here, you might think you want the Ford over here, but I have the Cadillac over here, and this is what you really want. You've just got to be able to sell them on that service. So yeah, all those things can help, but don't feel like you have to have it. And don't feel like this is the magic thing that's going to make me feel more confident. The way that you're going to feel more confident is by doing. So just get in there. If you want to start taking private clients, don't feel like, you've got to jump through some hoops before you can start, aside from making sure you've got liability insurance and those types of things. But that's not hard to do. Let's see. Let me go to the final question here. Had one more thing to say about the certification programs, but I think we've got it. Hopefully that helps, Lori, to answer your question. Again, oh yeah, I know what I was going to say. I did say before that the person who's going to be better at marketing and selling themselves is going to be the more successful one. Well, one of the ways that you can get better at that is simply coming across as confident. And the more that you can get experience, the more competent you're going to feel. And that's going to make you come across more confident. Think about if you are going in to have a major surgery, what kind of surgeon do you want? Do you want a surgeon who's kind of like, I don't know, I'm not sure if I'm the best at this, or that has that kind of that aura of not being sure of themselves? Is that going to make you feel good? Or are you going to want somebody who's going to come in who is going to appear like, we've got this, I'm going to take care of you, everything's going to be fine? You're going to want that as a patient. So you want to be that person, regardless of what credentials you have. All right, final question about autism. So we'll wrap up with that. Have a student that has high functioning autism. She only engages with tangible direct reinforcement at the end of a task. I generally don't use that, but she's roaming the room, conjuring up a pretend activity to do at the end, using items she finds around the room. It's distracting for the group. Mom is intense about language use and wants that freedom for her, but she's engaged in gains closer proximity when there is a reinforcement to look forward to. This is what the special ed teacher uses to get her to complete work as well. I was thinking of offering a brain break as a transition at the end of our session into class and have it in a box. I'm apprehensive because I want motivation to come from success, but she has proximity issues per her mom. She has ADHD, autism, anxiety. I'm really just trying to meet her where she is and help her engage, incorporate her interests, but now she's roaming and taking things to conjure up an activity at the end all the time, and it distracts the other students. Okay, so keep in mind that with sensory issues, there are students who need to be moving in order to concentrate. So maybe like I'm sitting here kind of like rocking in my chair, moving around, doing something so that I can focus. And then there are kids who need that movement, but they almost need that movement to kind of regulate themselves. But then in actually to be able to focus, they need to reduce distractions. So the thing is that people can control this more than they can learn to control this. And we also, while we want to give people what they need, meet people where they're at, give them the chance to explore, we've also got to teach them how to function in different situations if they're going to be able to function in different environments in this, in this world. So we've got to teach her how to interact in a way that's not going to distract other people. So I would say that with the behavior charts, you want to think of them more as you want whatever the reinforcement it is at the end, because we're all reinforced by certain things. We want to make it as natural as possible and something that you could realistically tie to something that could happen in real life. And you want the behavior chart to be not the reinforcement itself, but more of a data tracking mechanism. We like to see our progress. That is motivating to us. So it's kind of like on your to-do list, like it feels good to check those things off. And that's reinforcing to us. Or if we are working towards a particular goal, it's kind of fun to look back and be like, ooh, here's where I am. So you want to look at it like that. And when you frame it with her, look at it like that. So I would say that we want to keep her honest with those brain breaks. If it's going to take her so long, because remember, transitions are disruptive for people. And sometimes we can use them as a crutch. And so you want to give her those brain breaks, but there's got to be, if you're going to give it to her, there's got to be a specific end time. And I would say that she's required to sit and do whatever it is without roaming for a certain period of time. And then say, when you've completed X number of times, then you can get up and start moving. So it's kind of like how you have to sit and do your paperwork first before you can go like on Facebook or on the internet or whatever, or like you've got to do your work first before you can play. So that is a naturally occurring activity. So it's kind of like, we've got to do this first. I'm going to give you that, and use your chart, use your enforcement chart to show like, we've got to get our work done first. We're going to do this over here. We've got to sit and focus, because people can learn how to regulate themselves and they can work up a tolerance for those things. So maybe you only require her to do it a couple times. But the thing is that it can't be just all about her. It's got to be about those other students as well. I mean, we can't, if we're in a group of people, we've got to be aware of how our behaviors are affecting other people. So if it's distracting to the other students, then, it's like, this is part of being a team. This is part of being respectful for other people. I'm not going to just be coming in like roaming around being distracted. So I would work up a tolerance for her to sit and do something, like maybe you let her, I mean, maybe you have her sit in a chair for a certain period of time. Maybe you allow her to stand if she can tolerate that without wiggling around too much. Like, or maybe you have her sit on a yoga ball as long as she's sitting and facing you, whatever it may be. But see if you can work up a tolerance for that. And you start small and then work up over time, and explain to her why you're doing it. Like, you can train your brain to do these things. There is a lot of evidence that shows that we can train our brain to attend. Kids are trained now with all this technology. They're being trained to be overstimulated. So of course they need all that excess stimulation. They're neurologically impacted by all of this technology. But we can actually train ourselves to be focused on something that requires less stimulation. Now, yes, it's not good for kids to be sitting all day. It's not good for anyone to be sitting all day. She needs all of that roaming. What you want to do for her, and to also ensure, communicate to her mom that she's going to get that roaming time, is just make sure that you're clearly delineating, like, this is time that we're doing work. And then when we're done with this, this, and this, then you can go roaming around. But it almost sounds like she's using it as a crutch, and it is an avoidant behavior. And there is just so much. I mean, a lot of people are just coddled today. I actually went to see Temple Grandin speak in the spring, and it was fascinating because she said, why is it that so many people are diagnosed with autism? One, we're getting better at diagnosing it, but why is it that people with autism are so much less functional? Well, part of it is because a lot of people that were high functioning, before they had that label, like, you have autism, they just thought, they process things a little bit differently, and they were just out there working, working on the family farm, working in the factory, learning to build things, taking jobs, learning how to do things, whatever it was. They were out doing actual work, and they were learning to adapt. And so we're not doing kids any favors by, like, it's like we're kind of sheltering them. And she said that where before people were learning to function, and that's why they weren't being diagnosed, because their symptoms weren't as prevalent, because they were learning to function. And they were actually learning to use their skills, because we know that their brain is a little bit different. They might be attuned to things that we might not be able to do. And so, yeah, they were learning to function better in our world, and then at the same time be able to leverage their strengths to use those, again, because they're neurologically, they see things differently than us. They were able to do both. And now it's like, we're just so worried about sheltering them and letting them kind of just do whatever they want, that we're not holding them accountable. It's okay to hold her accountable, and, ensure your mom that, like, yes, she's going to get, I totally agree with you, she's going to get that time to explore or whatever, but we've got to do this first. Because if you're letting her just do whatever she wants, whenever she wants, you're not holding her accountable. You're not making her responsible for her behaviors, and you're not requiring her to be committed to anything. And so it's, I mean, we don't want to coddle kids. We want to be able to give them that loving push so that they do something that's a little bit uncomfortable for them. Like, that's good for everybody to do, is to do something that's not 100% comfortable for them. So yeah, you don't want to just, like, strap her down to a chair and make her sit for an hour, but, say, okay, for a couple minutes, we're going to sit. And if you can handle it, maybe we'll stand. If she's in a chair like this, like I've got this chair, and I've had students who are sitting there like this and, like, moving around in a circle, and I'm like, okay, you can't handle that chair. That's really distracting for everybody, or you're not being respectful to me. You can't sit in that chair because there's no way you're focused on me. Your eyes aren't on me. You're not showing me that you're paying attention when you're sitting over here looking at this. She's not doing what's required of her, even if she's asking questions. Like, think about how appropriate that would be if you were talking to somebody and they were like, sitting over here fiddling with this and doing this and spinning in their chair. That's not functional communication. Body language is important. So that could be something that you also pull in when you're talking about her mom. Well, language is not just speech. It's also nonverbal communication. And if she's roaming the room, she's not working on those things. So she's got to be able to work on those things appropriately. And that means that she's got to be present with me, facing her body towards me, making eye contact with me, not just talking to the wall over here, roaming around, messing around with this whatever she's doing. So I would say don't be afraid to hold her accountable. Yes, do the behavior chart. Do the brain breaks, but only when she really needs them. A lot of times when it's like, oh, I'm coming into my classroom, I need to wander around for 20 minutes. No, you don't. You need to sit down and work. I promise you, like, you're going to be able to do this, and maybe show her visually, like, we're going to do this, this, and this, like, if this, then that kind of a thing. First this, then that. Show her that, and just maybe you lay expectations with her and be like, you know, we're going to do this, and you can't, and have some consequence. Whatever she gets, if she doesn't cooperate with you for that certain period of time, then, you know, and she wants to roam around the room, okay, you've still got to do it. Maybe she misses something later if she chooses to wander around or whatever it is. And if the special ed teacher is using something that is working, use something that's similar to the special ed teacher so you guys can team up like that. And keep in mind that it's not the chart is just data collection. Showing people their progress helps them stay invested in it. And if those consequences are natural and you're just looking at this more of a data collection system and feedback rather than this sticker as your reinforcement or whatever it is, then it's going to be effective. So behavior charts are not a bad thing. It's just that the way that we're using them is not always appropriate, because we're seeing a sticker as a reinforcement. When we can use them as a data collection system and a feedback system, that's when they work. And when we can make whatever that consequence is natural, a natural way to regulate yourself, then, you know, that's when it's more effective. So think about it that way. So with all of that said, that wraps up the questions that came in. Oh, I thought I was going to come in for 5 minutes and it's been 45 minutes. But again, these are great questions. I think they'll be really beneficial to people in the group. And yeah, if you have any other questions for me, I will put them on the list for my next live, and I'll also be able to answer them in the group as well. But yeah, just send a separate thread and post those questions. And a lot of times I will answer it. And if I feel like it's a really good question, or if I feel like it's a question where I'm like, oh my gosh, I can't answer that question in a comment, I need to do a video, I'll let you know. Either way, I'll respond. I'll answer your question through a combination of comments and live videos like this. All right, thanks so much, everybody. And yeah, we will, I will be taking questions in the group, and let me know what your questions are, and have a great day.